Welcome to the Mini Medical School podcast, where we dive into the world of medicine. I'm your host, Kane, a first-year medical student, and my guest today is Dr. Phil Tibbo, professor in the Department of Psychiatry at Dalhousie University. He recently presented at the Dalhousie Mini Medical School on the topic of cannabis and psychosis risk. Thanks for joining us, Dr. Tibbo. Can you tell our listeners a bit about yourself and your research work?
Great. So as you mentioned, Phil Tibbo. So I'm a professor of psychiatry, also cross-appointment in psychology and neuroscience as well. So I am a psychiatrist, but I'm also a researcher as well. So I do hold an endowed research chair position at Dal. It's called the Dr. Paul Janssen Chair in Psychotic Disorders, and that allows me some protected time to do some research as well. And I'm also the director of research for our department.
Wow. So it looks like you carry a lot of hats there. So our first question is talking about the impact of cannabis legalization in Canada. So what has changed?
Yeah, great question. And I get asked that a lot. My research area, as you pointed out at the start, is around that intersection between cannabis and mental health, and specifically cannabis and psychosis risk as well. In Canada, we've had a wonderful sort of national experiment go on for the last 5 to 6 years with legalization in 2018. And you asked about the impact of it. And I guess to address that, we should probably go back to kind of just reflect on why, the government moved towards legalization as well. And there's probably 3 main areas to kind of consider. And one being is really to improve, cannabis-related public health and safety, but as well some of that protection around our youth and young adult and child populations as well. Decreasing cannabis-related harms, access to product as well. And probably the third one as well is to have an effect and impact on the legal aspect. In other words, charges, offenses with respect to cannabis products as well. So that was, the gear towards, that was sort of the main reason why legalization was, happened within our Canadian setting. So I guess we have to reflect on that and say, okay, has there been any impact on that, right? I think overall, I'll say that there's probably been mixed impact right now, right? However, just to mention that, we're only about 5.5 years out from legalization. It's really too early to tell some of those long-term impacts, right? We do need a bit more time to look at some of those metrics and look at some of that data to see if we're reaching those particular goals. And of course, the other thing that affected this and us being able to evaluate it is we had a COVID pandemic. So that kind of messed up, being able to look at some of these metrics as well. I mean, if we just go into some of those specifics, what we have seen and through some of the Canadian Cannabis Survey data and other mechanisms as well, we have seen cannabis use go up in various age groups. It hasn't skyrocketed as some people anticipated, but we have seen use go up in various age groups. But we don't have a good data to say, does that equate to cannabis use disorders and other kind of negative outcomes as well. All to say, on the background of that, though, is that Canada has one of the highest rates of cannabis use in our young adult population amongst all the developed countries. So our base rate's quite high, but it didn't skyrocket. But it did go up a bit and maybe coming back down a little bit as well. And there's other sort of metrics that we can look at with respect to that. We have seen increases in cannabis-related presentations to the emergency departments, all-cause presentations. And that's been fairly consistent. Of course, we can always interpret that data and kind of critique that data, wondering if, people are more willing to talk about cannabis now that it's legalized, and therefore, somebody coming in to emerge, they can relate that to their presentation. With respect to things like driving, we probably haven't seen a whole lot of change with respect to driving while impaired with cannabis. In fact, there's some data out of BC saying that may have increased a bit. Perhaps the biggest impact on that, around charges, the legal aspects, right? That has definitely gone down. So perhaps, we've had a better impact there on the social justice angle of things. With respect to access, some of our recent data has shown that probably of those people who are using cannabis, probably 2/3 of them are getting it from a regulated supplier, depending on the province, of course, of where you're in. So that probably is another benefit. So the impact, it's mixed. Has it been a complete failure? No. Has it been a complete success? No, as well. But we do need some more data. We do need some more time to really be able to assess that.
So you brought up a lot of really good points. I just wanted to go back to the question about impact to youth. Do you see this increase in legal age or under legal age?
Actually, we see that in both. And again, different mechanisms to try and find that data. If we look at the Canadian Cannabis Survey, which has been done every year since legalization, they do break that down. The youngest age they do is 16, so 16 to 20, and then we have, say, 20 to 24, and then further age groups after that as well. And we see in all those age groups that use has gone up, and that base rate, those, as I said, just mentioned, is really quite high. And we've seen that use. If you look at the data with 12-month prevalence rate or use in the last 3 months, that's gone up. What hasn't changed, although it's still a concerning data point, is that the rates of daily or almost daily use of cannabis within our youth and young adult population hasn't changed. And that's still at about 1 in 20, about 20% of our youth and young adults are using on a daily or almost daily basis.
That definitely is a concerning trend. And you talked about psychiatric visits. And are you seeing that influence schizophrenia? Are you seeing more psychosis?
Yeah, no, really great question. Again, part of that goes to what I mentioned before is that, perhaps now people are more willing to talk about their cannabis use, and we're perhaps, a little bit more attuned to being able to ask those questions and get be able to have those good open conversations. We see data, again, we don't have the Canadian data necessarily on that. There has been some early work out of some of the Ontario administrative data sets that have seen an increase in cannabis-induced psychosis. We definitely have seen that in some of our European colleagues and different mechanisms, different ways of research that actually have shown that there's been an increase in psychosis rate development, like that incidence of psychosis based on cannabis use, but also based on particular variables, right? So in other words, it's related to daily or almost daily use or that high potency product as well.
And when we talk about cannabis, we think about the active ingredients, CBD or THC. Is one of them more likely or less likely to be an impact?
Yeah, no. With respect to negative outcomes, it's mainly around THC, right? So THC being the active, psychoactive component of cannabis, that's what gives us the euphoria, the high. That's THC. CBD has another sort of mechanism. It works a little bit different on the endocannabinoid system. Could even be perhaps a little bit of protective mechanism as well. So, but when we're talking about negative outcomes, it's with THC.
And is there any synergy with other medications, for example, amphetamines, caffeines, to induce or further increase the risk? Yeah, I wouldn't really call it a synergy, but it's more like additive effects, basically, right? From the biological standpoint, we may not see that synergy, perhaps is what you're reflecting. But yes, we do see, and if you look at any sort of harm reduction strategies or low risk use guidelines, it's really trying to make sure that any other substance use is minimized because, less substances, less negative outcomes. When you think about the use of it, we also think about the frequency and the amount. How do these impact it? Yeah, no, and that's the sort of really the kind of the important message and one that we try to get across to our, youth groups and having them informed about, just healthy use and harm reduction strategies. Occasional use is probably not going to have any effect on most people, right? Where we try to focus our attention around harm reduction strategies are those people who are using on that daily or almost daily use, who start that at an earlier age, and also, again, that high THC or that high potency product, because those are kind of the three variables that really increase that risk of mental health negative outcomes. And so is there a recognized safe age to start this or a safe amount to use? Yeah, I get asked that a lot. It's a difficult one to say, right? I mean, really, when you look at harm reduction, again, it's more if you can wait till later in age, into your 30s, great. If you can do that, wonderfully, right? If you're going to be using as a teenager or youth and young adults, again, it's using it responsibly as well, right? So my rule of thumb that I usually will say, and I've done talks to high schools and junior highs, is that it's supposed to be a pleasurable experience. If it's not, if it makes you a little bit anxious, if it makes you paranoid, a little bit sketched out, you're probably at risk for developing a longer-term negative outcome. So it may not be the right thing for you, right? So it's about getting that information. We know, again, just, is there a safe amount?
it depends on the individual. There are some people who could smoke a fair bit and won't have any negative outcomes. But we do have to mind that, daily or almost daily use and that potency. I know I've been saying that a lot, but those are kind of the main variables we really have to think about.
I know there's been a recent trend in medicine to think about a harm reduction approach. If someone is to use cannabis, is it better to use vape? Is it better to use an edible? What is the safest way?
So now, you're talking about mode of use, right? So from a harm reduction with respect to how you're going to use, well, first of all, anything that you inhale into the lungs can produce, ill effects on lung health, right? So, we talk about our combustibles, and so that's, smoking a joint, a bong, a bowls, even vaping as well. So they can have ill effects on lung health as well. If you're kind of looking at that perspective, then edibles is probably a bit more safe than those combustibles, right? However, of course, edibles comes with its own issues as well, because sometimes, and a lot of our public perhaps don't know how to dose their edibles as well, because as you know, it's a longer time to get an effect, and people may take more than they need, and it just progresses perhaps into kind of a toxic, more like situation.
So a common phrase I hear a lot of people who do use cannabis, they say it's for self-medication. What are your thoughts about unorthodox use of this medication?
Yeah, it's a really great thought and question around self-medication. I always kind of go back and say, well, first of all, we have to figure out what are you self-medicating for, right? I think that's an important point. And is this the most appropriate method for self-medication, right? Not to say there are other medications perhaps, but maybe there's other ways if you're feeling a little bit more anxious, right? Well, there's other kind of cognitive behavioral therapy strategies or mindfulness-based therapies and strategies that you can use to help deal with that versus perhaps using something that potentially can cause adverse outcomes and actually even make it worse, right? And we do see that self-medication, there's a little bit of a vicious circle sometimes. Somebody may use it for anxiety, use it for a longer period of time, and actually it's because of the cannabis that the anxiety, sort of gets entrenched there as well. And so, we just want to see, if somebody's saying they're using it for self-medication, it's really good to try and identify why, what they're using it for, and look at other strategies other than cannabis.
And would there be scientific evidence to support using it? As I understood it, a lot of the early literature suggested epilepsy, for example, was a valid use case. Is that true, or is there any truth to it?
Yeah, no, there are some indications. There definitely are, but they're not as widespread as what you'd think they'd be, right? And we did a report recently, and we kind of looked at, okay, if you're using it as a medication to treat something, then it should follow the same guidelines, the same structure that Health Canada would use to approve any substance that's going to be used for a treatment, right? So that's looking at randomized controlled trials, systematic reviews, meta-analysis of randomized controlled trials. Basically, at this point, there's just not a lot of information out there, right? One good example, even people are aware, and it's almost like common sort of talk that, you can use cannabis to help treat symptoms of PTSD. There's actually only been one randomized controlled trial to date that has looked at that with kind of mixed results. So we have to be mindful of that literature out there. That's not to say that it couldn't potentially be helpful, but we need a lot more research in that area.
Yes, so it looks like a very interesting field. I also hear another common perception is individuals will compare alcohol to cannabis. They'll say alcohol is linked to a significant amount of mortality while cannabis isn't. And I find it's used to justify the use of cannabis. Do you see this as a valid comparison, or what are your thoughts on it?
Well, it's an interesting question that they're defining their use based on mortality versus other sort of negative outcomes that can happen as well, right? Well, yes, if sort of intoxicated, toxic state, yes, alcohol, obviously people know the outcomes, potential outcomes of that. If you look at toxicity from cannabis and its relation to mortality, death, actually it is pretty low, right? In itself talking about toxicity. Where we still see mortality sort of figures are around things like injurious behavior, motor vehicle accidents, for example, occupational injuries, things along those lines as well. So, but from a toxicity state, not necessarily like the cannabis plant is that linked to mortality, but the outcomes of driving a car while high definitely has mortality implications. The only sort of caveat I would put in there is that we do have synthetic cannabinoids out there as well, that are just made in a lab and sprayed usually on some type of herb and used that way. That's sort of a different compound altogether. And with our synthetic cannabinoids, there is more mortality attached to that than you would within a cannabis plant.
Okay, so a lot of things parents are concerned about is their kids getting involved in cannabis at a young age. Is there anything you would recommend for a parent to do to prevent this?
Well, I think it's very important. And actually, some really good information out there for parents on this, because parents are nervous about it, right? And oftentimes, parents struggle with how to have the conversation with their teen. And there actually is some really good information out there, some brochures and pamphlets and other mechanisms to help guide parents have that conversation with their teens. Right, because it's being able to have that conversation in sort of a non-judgmental way, just being open about it. May reflect on your own use when you were young as well, so that you can actually have that open and honest conversation, and also being able to know what the potential long-term harms could be, so that you can make sure that teen has all the information they need to make an informed decision. Part of that is just having that open and honest conversation, and also having access to resources as well that can help with that. So I think, most of that, as a teenager, of course, appreciate that. Sometimes it's not even, doesn't matter what the parents say, it doesn't matter. They're still going to try it. Fine enough. But as long as they have that information to know that, all right, if this is not going down the right path that they think it should be, then they would know enough to stop.
And when we think about some of the other long-term effects, is there any indication it can affect cognition or career trajectories if started at an early age?
Yeah, another great question. So we do know that long-term chronic use of cannabis, yes, it can affect aspects of cognition. Tends to be aspects of memory, verbal working memory, and other aspects of memory, but as well as attention and concentration as well. Interestingly, what a number of the studies have shown is that if you're able to stop cannabis, a lot of that can be rectified, right? There is a subgroup of people where that will continue, and we're trying to figure out, okay, what puts that group of people, what kind of risk indicators are there for that person, for them to have that outcome versus somebody would have a better outcome. So yes, it can affect those things. And of course, if it's affecting attention and concentration, memory, things along those lines, yes, it can have an impact on, education, on job performance as well.
Okay, so I just have one more question. What advice would you give to a student interested in pursuing a career of medicine?
In general?
In general.
I would say, yes, do it. Medicine's is a great field. I got into it thinking I was going to be on one particular path, ended up in psychiatry, was not my field that I thought I would get in at all. And it's just an interesting path, and it's just a wonderful way to interact with individuals, to, help individuals. And even if you're able to get into some of that research component of things, be able to answer some of these questions that you have clinically as well.
Thank you for your time, Dr. Tibbo, and your insightful discussion.
Oh, my pleasure. It's thank you for some attention on this particular topic. And I'd be happy to answer any further questions if this has produced any questions in anybody as well. So feel free to reach out to contact me.
And thank you for the audience for listening, and see you on the next one.